everyone. My name is Chance Banda. I'm the focal person for quality improvement in Sanje District, Malawi, and I'm with my colleague here.
And I'm Bilem Zigora. Hi everyone. I'm also a quality improvement focal person for Sanje District Hospital.
Well, thank you, Billy. So as you have heard from Billy, we are experts for quality improvement in the district, and we are the mentors who basically visit the health facilities in the district to supervise and even mentor on quality improvement initiatives. So well, today we would like to share with you one of the success story on quality improvement projects that one of our health facility had been implementing way back in 2022, which started in July 2022 up to December 2022. So I myself and Billy, as we went to this health facility during the QI related activities, we did the supervision on documentation of the Partograph amongst the women that were delivering in Ndamera Health Center. So we noted some gaps in the documentation on the Partograph. So the team had to sit down and they had to plan to run a quality improvement project on improving the documentation of Partograph. So I just want Billy to shed some few lights on the change ideas that this work improvement team from the Ndamera Health Center adopted so that they should bring a change in the quality of care that was being offered to the maternity section. Over to you.
Yes. Thank you, Chance. Well, you might recall that the team came up with 3 change ideas, and the first one was to conduct continuous professional development, whereby they wanted to be teaching each other for a month, and about 5 midwives were involved in this initiative. And the results from it were indeed good, because they managed to come up with about 62.5% of Partographs that were documented completely. And then they adopted this change idea. They saw that it was a good one. And then they moved to another change idea. They wanted to be reviewing the Partographs on a daily basis for about a month as well. On this one, of course, the deliverables were good, but they met some challenges, and so they decided to adapt so that they could be doing it weekly and not daily. And then thirdly, they also tried to implement another change idea using the PDSA model, and this was about peer-to-peer mentorship, which was also implemented for a month. 5 of them were involved, and at the end of it, by the end of the month, they managed to come up with 85.7% of Partographs that were well documented, and they decided that they should adopt this one. Yes, Chase, you might also want to give some results.
Yes. Yeah, for sure. So as you heard from Billy, and as we already indicated right at the beginning, that these people were 20% as their baseline, and they aimed to achieve 85% of complete documentation on their Partographs by December 2022. Now, after implementing these change ideas that Billy just spoke about, at least an overall achievement was they had to move from 20% to about something like 54%. Now you can agree with me, just as Bill has explained, documenting the Partographs has proven to be a challenge in the resource setting, in the low resource setting. We have already a lot of challenges. You look at inadequate human resource, you look at inadequate funding for trainings. Now, looking at the interventions or the change ideas that this work improvement team from Ndamera came up with, we could see that these really are change ideas that would tremendously bring an improvement as far as maternal and neonatal health is concerned. So maybe Billy would also just want to add something on maybe what could be some of the recommendations that we as a district have recommended for the sake of improving the entire health facility, the facility functionality as far as maternal and mental health is concerned?
Yeah, well, Chancellor, you see, this seems to be like there are small initiatives,
Oh,
but
yes.
they can go a long way,
Yes.
especially in the settings that are resource constrained. Yes, so we'd like to recommend that the CPDs, the continuous professional development, should be normalized in most of these settings where labor and delivery services are being provided. We would also like to recommend that the peer-to-peer mentorship, because we understand that different people are gifted differently, and they know each other well. They understand the gaps that each other that each and every one of them has, and so if this can be normalized as well in the health facilities, it would also do a greater good to the mostly to the patients and the laboring women as well as the neonates. Oh, and also just to add on the monitoring, it's very important to be checking on the documentation. Yes, I would also like to encourage that teams should be able to be checking what others are documenting, sort of like auditing, so that they improve on the documentation.
Yes.
Indeed, Chancellor, you might want to give something like a conclusion.
Yeah, well.
Yes.
So as we have already discussed, Billy, you might also agree with me that this is one of the areas that, as a district, would want to roll out in other health facilities, so that they can at least also work on these change ideas that Ndamera came up with, because at least we have seen some tremendous improvement.
Yes.
Even now, they have sustained this practice. We're talking about December, but when you go to the mental health center now, because they have taken it as to be part of their system, they are keeping on improving. And if you can measure the change today using the run charts, you see that at least by today they should be something around 100%.
Yes.
Yeah. So we really recommend, and we are really glad that something has happened through implementation of quality improvement projects. So for today, this is what we had for you.
Thank you very much.
Bye bye.